We do have quorum for our Budget and Finance Committee meeting. As a reminder, we will not be voting on anything today. This will just be a Q&A session. And we also have the chair of our Public Health and Safety with us, Councilmember Evans, and we do not have quorum in Public Health and Safety, but again, we are not voting today. We don't have anyone that is signed up for our public comment period, so we're going to open it up by inviting our Director of the Tanae Franklin from the Board of Health to come on up. And we also have Dr. Ariola with us and anyone else that they want to bring up. And Dr. Franklin, if you want, you could speak from back there, or if you like, you can speak up here, whichever one is your preference. You can come on up here. And then Dr. Ariola, we're going to ask you to come on up here as well. All right.
Good afternoon, everyone. My name is Tanae Franklin, and I am the chair of the Board of Health, and I have served on the board for a little over 5 years now. And I do have brief comments just to sort of set the tone for the conversation that you're going to have with the incoming director. Members of the Budget and Finance Committee and Public Health and Safety Committee. In May of 2004, the Board of Health underwent a strategic process to align on the qualifications for the Director of Health. This was an inaugural process that balanced evidence-based practice as well as the pulse of the community stakeholders, specifically elected officials, Metro agency partners, community-based organizations, faith-based organizations, and the public health workforce. While our previous director maintained post-pandemic stability in the health department, there were unrealized opportunities to champion strategic growth when it came to community engagement, innovation, and systems change. Using the Public Health Foundation's core competencies for public health professionals as a guide, the board underwent a comprehensive data-driven process to align on competencies and capabilities for the position of director. The core competencies for public health are made up of the following domains: data, analytic skills and assessment skills, policy development and program planning skills, communication skills, health equity skills, community partnership skills, public health sciences skills, management and finance skills, and lastly, leadership and systems thinking skills. Each of the domains are made up of sub-competency statements, which I will email to you shortly. The board's process of alignment included prioritization of these sub-competency statements. It is important to note that we also asked the executive leadership team of the health department to select and rank competency statements they felt would be important for the director to possess. In addition, we also solicited qualitative data in the form of written comments to complement their prioritized rankings. The board then went through its own prioritization and ranking process and robust discussion in the May 9th board meeting. The aggregate scores of both the Board of Health and the executive leadership team were in alignment, confirming that our change management process for the leadership direction of the department was off to a good start. The prioritized and aligned core competencies were foundational to the job description and application tools that were created by the board and Metro Department of Human Resources. The application tools were applied to 3 interview phases: the written interview, the panel interview, and lastly, the final interview, which was open to the public. The board also added another vetting point for the search process. We asked the final candidates to develop a public-facing public health presentation which focused on the intersection of community violence, opioid use, and suicide. These areas have been championed by the rank-and-file public health experts in the department well before the pandemic, and that continues to date. On November 21st, after an 11-hour day of interviewing candidates, which included over 2 hours of deliberation, the Board of Health unanimously voted for Dr. Sanmi Areola to be Metro Nashville's next Director of Health. Thank you.
Thank you for that. And thank you for your work and your leadership. I know this has been a lot of work, so we thank you and appreciate you for all that you've done. And with that, I'm going to turn it over to Dr. Areola to give any opening statements or remarks that he may want to give, and then we will open it up to the two committees for questions.
Good evening, Chair and members of the committee. Sami Areola, and currently I am the Deputy Chief Administrative Officer for Health, Human Services and Education for Prince George's County, Maryland. And this role I oversee the Department of Health, the Department of Family Services, the Department of Social Services, the library system, and the educational system. And I've done that for slightly over 2 years now. And prior to that, when I left Nashville, I went to become the Director of Health for Johnson County, Kansas. Johnson County, Kansas is the largest county in Kansas with about 25% of the entire population of the state. And in Nashville, I was here for almost 18 years with playing multiple roles. A couple of times as interim director, last few years as deputy director, and I came in as a toxicologist, largely working on public health, emergency preparedness, and environmental health, and several other leadership positions. So I've done public health, local public health, because I think it's important to understand the difference. Local public health is very, very different than state public health, definitely very different than federal public health. And so that's the first thing. The second thing is to be pretty clear that public health is not healthcare. I think that's one of the challenges that we have. The way to look at public health is to look at it as everything that happens to you before you need to seek healthcare. And so what we do in public health is different from what the primary care physician does or your doctor who is diagnosing illnesses. What we do in public health, and that's really getting into my strategy for doing public health, is to create conditions all over the county where everyone, no matter how old they are, men, women, no matter what their races are, no matter what their sexual orientations are, to create conditions where everyone has the opportunity to be as healthy as they possibly can. That's what we have to do in public health. There are many, many times because of events that happens, like the pandemic, that was a big one. Prior to my leaving, we had a tornado here. Those things come. We had Zika here, we had Ebola here, we had West Nile virus here. Public health must be prepared to deal with those emerging events. But more importantly, we have to stay focused on creating what I call a culture of health, creating conditions where everyone has the opportunity to be as healthy as they possibly can. The second point that I want to emphasize before I take questions is also to make it clear that my role as the Director of Health, I have two broad responsibilities. The first one is to run a good internal operation. You have to build the right organizational culture. You have to be very clear about what you're trying to do, why you exist. You have to be very clear about how you treat each other. You have to be very clear about the goal being moving the needle in metrics of health. One of the key things that I use with my staff and I refer to is Patrick Lencioni's The Advantage. If you've read that, it's you build a cohesive leadership structure, you create clarity, you over-communicate clarity, and you reinforce clarity. That clarity as to the mission is very, very important. And the last piece for me is that leadership is work. There's no question about it. The work of leadership, people that work with me, that's what I expect them to do in the morning, in the afternoon. It's to build the capacity of our staff to be able to function optimally so that we can serve the public. There's a reason we call it public health. It's very important that we involve the public. Before, when I went to Kansas, I was hired to implement public health strategy, what we call public health 3.0. And I left Johnson County with a blueprint that we call Moving Health Forward, JOCO. The 4 key things are going to be what I continue to do. One is to build a culture of health. The second one is to build bridges into the community. Nurture existing relationships, build new ones. It is literally impossible to do public health without the involvement of the public in the process. So one of the things that I tell people here, we do public health by assessing risk, and based on that risk assessment, we come up with feasible risk management options. You cannot assess the risk if your assumptions about the community that you're serving are not true. So the only way to define or to ensure that those assumptions are true is to define them from the perspective of the community, from the perspective of those that are impacted. And so if those assumptions truly represent the community, the chances of your results from risk assessment to be true goes up. And if your risk assessment is accurate, the chances of your risk management options succeeding also goes up. So there's a reason why we say the public has to be there. The third thing for us that we have to do is to ensure that we are focused on policy that impact health. Here we call it health in all policy. Where we are is a consequence of the policy decisions that we made 10, 20, 30 years ago. So if the future will be different, we have to come up with policies that are consistent with the future that we envisage. And so it just doesn't happen in a vacuum. The old saying, if you keep doing the same thing over and over again, you get the same result. And so we have to be bold to look at things differently. That strategic level, where the healthy option is the default option, is what we have to be bold to do. And of course, the fourth thing for me, and that's very important, is to create a culture of good, spectacular, consistent customer service. If we do those things, we would, the community will know that the health department is focused on their task. They will respect what we do, they will work with us, and that's what we want. And so that, we still have to do all of those basic things. The 3 things I was told to present on community violence, suicide, and overdose, they're things that I've worked on. I actually oversaw several of them here while I was in Nashville, so very comfortable with the details. But if we do those things, where we involve the communities that we are serving, where we include agencies that know the community that are working on these things. If you see a lot of these not-for-profit organizations, really, they start their project based on what they see happening in the community. They start those things based on the needs of the community because they are part of the community. So we cannot be in the office and think we know the community better than they are. Our job is to work with them to ensure that the capacity is large enough, that they're able to do those things long enough to be able to make meaningful impact and move the needle in metrics of health. Happy to take any questions that you may have.
Thank you so very much for that overview. We're going to start off with our Public Health and Safety Chair, Chair Evans, and then we will go to Councilmember Cortez, followed by Councilmember Bradford. And if anyone else wants to jump in the queue, feel free to raise your hand after Councilmember Bradford. So we'll start with Chair Evans.
Thank you, Chair, and thank you, Dr. Ariola, for coming in to speak in front of our committee today. Can you speak to your time away from Nashville, because you were a deputy in interim and then you left for about 4 years and now you're coming back? What are the things that you learned in the two communities who you worked with that you think, in reflecting about your time in Nashville, like what are things that you would like to bring back or emphasize or do here that maybe we haven't done in the past?
Thank you, Chair Evans. I would say that as I was preparing to apply for this position and to interview, the different stages of the interview brought back a lot of memories. I was part of several things in Nashville. I led the efforts around testing radon in all the schools and every metro department. I was led the effort in lead in drinking water in all of our schools. Internally, I was over developing protocols that shaped the culture of the organization, including how we treat each other, how we recognize our staff. Staff will remember that a consistent message from me is that our staff are our most valuable asset, and we have to be consistent. I was part of the effort in ensuring, and I led the process for performance management. So I was pretty clear about the role of leaders in a department. If there's a vacuum in the leadership, you may not see it in the first 6 months, but within a short time, you're going to see that, because I think if you lead a department right, people are going to know that. They're going to trust what you do. You'll help them see maybe things that they otherwise would not have seen by themselves. So by the time I left Nashville, I was pretty clear about my public health approach. As I've described, the strategies, the upstream factors, rather than putting band-aids. Now, I do acknowledge that we have to do that. I was also very clear about my leadership style, and I wanted the opportunity to put that into practice, and I did that very well. Feedback, excellent. And so in terms of the things that we did in Nashville, there's a lot of positive things we did, like the Healthy Nashville Leadership Council, the health summits that we did, the CHAR, the CHIP. There's so many good things because we had so many progressive public health policies in Nashville. And I knew that I'd always been very up to date with the public health world to know what's going on. And so for me, the biggest difference, and I hope that that's one of the things that I do, is in the leadership arena. First of all, for me, is that leadership is work. And leadership builds capacity. In Kansas, we call it LEAP, Leadership Empowers All People. And the idea is you have to be intentional about building the culture that you want to build in an organization, because culture will shape you. So it's better you shape it the way you want it to go, because if you don't, it's going to shape you either way. So if you want, you got to be very consistent. To build a cohesive leadership team, you have to consistently emphasize to everyone that they are leaders and allow them to do their jobs without sitting on them. The approach of moving away from being punishers to building up and coaching and allowing people to make mistakes so they can grow, and creating an environment that's now one where people are scared of making mistakes, or one that you allow them to, so the innovativeness can stay. And the confidence that if I mess up, I'm not going to get into trouble. That's how you build leaders. That's how you build a department where, from the person that's taking the call to the person that's sweeping the floor to myself, I understand that they are leaders. And it's not just the job of the few of us on the ELT. Because the impression that people have about the department is not necessarily because of the director. It's about maybe the first person that took their call, maybe the person that they saw that was doing their food inspection. So that empowerment of staff is what, that building that organizational culture is what I hope to implement and sustain. Because if we have the right culture, and I'm not unaware of the impact of COVID. I lived it. I led that process in Johnson County. And so public health staff are still recovering from those things. But we create the right environment, the right culture. our star will rise up again, and we'll see that in metrics of health moving the right way in the near future. That's the biggest part of it for me.
Thank you.
Councilmember Cortez, you're recognized.
Thank you, Chairs, and thank you, Doctor. Thank you for your previous service to the city and willing to come back and serve again. I really appreciate your comments on building a culture of health and building bridges into a community. We're currently in a point in society where people are very siloed, and information for each silo has its own filter. So I have two questions. One, how can we, from your perspective, build influence with all those silos out there and connect with those people to create a culture of health and build bridges into the community? And also, from a policy perspective, what can this council do to help in those efforts?
Thank you, Council Member, for the excellent questions. Throughout my career, including here in Nashville, what I try to do is to build those bridges. The silos are always there. I don't want to give the impression that we live in isolation of what's going on in the bigger world. We don't. But, you know, Johnson County, for example, it's kind of like a purple county. It was red, trending blue, but it was purple when I was there. And I just remember talking to really elected officials on both sides. A person who was the former Senate president, who is a physician, and behind the scene just kind of probing what's going on. How do we pacify people that are aggrieved and upset about the restrictions? And how do we pacify people on the side that feels we're not being stringent enough and not doing enough? And I'm telling myself, so if you lose either side, you lose 50% of your population. How do you make a contention that you're trying to create an environment where everybody can be healthy? And so that's why you've got to meet people where they are. Even in Nashville, I know this has changed. While I was here, I did know a lot of people on this committee, and I work with a lot of people on this committee because you know the community. And people speak to you a lot. And I know that because I've worked with, for those that follow me on social media, you see I work with elected officials a lot. You will see me with local elected officials, state and federal. That's just part of it because you are out there. You're hearing from your constituents. You are hearing what their concerns are. And that's kind of feedback into what we do. Look, the biggest lesson from the pandemic is this. Public health, there's a lot of experts in public health. We know what to do, or we think. And so we tell people, this is the danger. This is what you've got to do. We've got to lock this thing down for the next 6 months. That's what we learn. You've got to take into consideration political dispensation and tolerance of the community that you are dealing with. And because if not, then you politicize it and you are not effective anymore. So that plugging into the community wherever they are and building those relationships prior to a pandemic is very important. So we had places that we don't engage. We have people that we don't engage. And then we had this pandemic and vaccines, and we're like, come and take the vaccine. In some cases, we'll even give you $300 to take the vaccine. And they're looking at you like, so that would be something in it for you, because you never came to talk to me. All of a sudden, you want to pay me to take the vaccine. So that's not going to happen. We have to develop those relationships ahead of those incidents. We have to develop those relationships even in building those cultures that we need. You asked what the council can do. Prior to leaving here, I don't know if he's still there, the guy who came in as the finance director just before I left the state, and Christian with the mayor's office, I met with them. I could look into your county and tell you where health is bad, simply based on your budget the last 10, 20 years. I can tell you where you are invested. So we know what works for health. If I'm in a community and the sidewalks are bad, if I'm in the community and I see poverty, I see overgrown population, I see dogs running at large, I'm telling you that community is poor, it's abandoned. And a lot of what you are talking about, community violence, suicide, some of the protective factors are educational achievement, socioeconomic status, aka poverty. So if you're going to be resilient as a community, let your budget speak to what you're trying to do. So when I walk out, so it doesn't matter how much you teach people to do, they are going to do things that are easier for them to do. If you want people to go for a walk, make sure that the sidewalks are good. Make sure that they are being policed the right way. Make sure that dogs are not running at large. If you want people to eat healthy, don't just tell them to eat healthy. They got to be able to afford it. And guess what? They can only pick from the options that are available to them. If you don't have grocery stores there and they can't afford it, you can tell them all to eat healthy all you want. They can't see it, they can't afford, they can only pick from the options. That's where the policies got to match what we're trying to do. And before I left, we worked with the planning department to include equity considerations into your capital project decision making. It's not the decision to do it, but take those into consideration. So a lot of you are trying to build resilience as a community. Those are the things that we have to factor in, and let's put our buck where we want the bank.
Thank you, Doctor.
Thank you so much, Councilmember Cortez. Councilmember Bradford, you are recognized.
Thank you, Chair Porterfield. First of all, congratulations on your new gig. Couple of questions I have for you. First of all, I'm not the only one on this council, but I've kind of very early on led the charge on supporting Metro Animal Care Control. You know, right now they're in a facility that's more than 20 years old, and it's no longer adequate for the needs of the current size of the city. And so I was just wondering, where do you see MAC in relationship to the Department of Health? And would you commit to working closer with MAC leadership to ensure that their needs are being met and that their funding needs are being met going forward?
Thank you, Council Member. So I'll answer the second one first, and that's yes, 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 because that's what I was doing before I left here. I oversaw animal control while I was over Bureau of Environmental Health. I oversaw animal control as the deputy director until I left. I remember when Nancy Whitmore was over here. And at some point we had issues with animal control and she was kind of providing oversight. I think that was prior to Mayor Cooper. And she told me I was the only one she was going to hand over control of animal control to. So a lot of what we are seeing, like the Friends of MAC, I was part of those initiatives. Several of the community groups, I sat with them. I've been part of several brain sessions. And yes, that building needs, I taught the facility when I came for interview and I spoke to the leadership there. I will work with you. Look, we don't want a blight on us as a county. That facility, even before I left, we knew that considering the growth of our county, forget about the other problems it's having, it's just not big enough to serve the needs of a population that's growing. At one point, Nashville is one of the fastest growing cities in the United States. So yeah, you're speaking my language. It's a need that I think is way overdue, one that I think we need to work on it.
Well, I'm happy to hear that because we have been working over the last year or two to get a new shelter, and at this point we just need a big push from our new director of health to see that we can get that funding to build it in subsequent budgets. The other question I have is to your point on the public health and going out into the communities. Part of my district along Murfreesboro Pike, and I'm sure other colleagues have similar areas, not only is it a healthy food desert, but it's also a healthcare desert. There's no clinics, no access to healthcare. And I'm wondering, besides a big push to rebuild or get a new Woodbine clinic, would you see the forward progress of the health department as opening smaller clinics throughout the city so that all neighborhoods have some access to healthcare?
Thank you. I think every neighborhood needs to have access, easy access to healthcare. I would say a couple of things. First of all, is that local health department, the Metro Public Health Department here, we don't do direct care. Okay. Now, having said that, there's some cases where we do very small, but public health kind of moved away from that model several years ago. But it's our job to ensure that we have adequate coverage in the county. for those that do it and do it well. So here's what I've done, and I think it's on the web. Feel free to share. It's the first place that I've been in Prince George's County that I've seen a lot of challenges in healthcare resources. But what you do as director of health, you've got to understand the climate and adjust to the climate, know what the gaps are, and try to fill the gap. And so what we did was we actually commissioned a study to put numbers to that. We look at, for example, the ratio of primary care providers to residents. We look at spatial spread and those things. And we made the case and convinced the county executive, who is now one of the two Black female senator-elect, Angela Ossobrooks, that's my boss in Prince George's County, convinced her to make health a legislative priority, and she agreed. And we drew up 5-year plan. We put in the numbers with the reasons why the deficit is there, and you are going to hear even more news as part of this effort in the next few weeks. That first year, because the county was in a very tough budget year, we approached the state with those challenges, and we brought in $38.8 million to support our hospitals and FQHCs that are expanding into those parts of the county where we have the gaps. And so it's what I do all the time. I was doing that here. I meet very regularly with all of our health systems. You will see me meeting again, Meharry, General, Vanderbilt, Baptist. You want to understand what they're trying to do, where they expand, because again, for them, economics is a big piece of it. You know what their plans are, but you also want them to understand where the gaps are in the county. And when you do, they may come to you to ask for support, but typically from my experience, they already know where the gaps are and they're expanding into those things. The last thing I want to say is everywhere that I go to, the expectation is that the local health department has to do all these things. If that's what we try to do, we will be very inefficient. That's why we use the word local public health system. Our job as health strategists, not to try to do everything ourselves, is to get people who do those things better to understand that there's a gap and support them in doing that. So yes, we'll be working with our FQHCs, our hospitals, to ensure that they know those gaps and that the county is appropriately covered.
Thank you. That's all my questions. Thank you.
Thank you, Councilmember Bradford. Councilmember Huffman, you're recognized.
Dr. Ariola, hello. First off, welcome. Definitely happy to have you here. Looking forward to working with you. I'm curious your really experience regarding homelessness and your views on that moving forward. Our city continues to grow with that as a problem. That's definitely going to continue to persist moving forward, especially in the areas of infectious diseases, mental illness. There's issues with substance abuse. A lot of issues, a lot of territory you could cover here, but just overall, you're curious your views on that.
Thank you. Homelessness, I am overseeing the effort as part of my Department of Social Services in Prince George's County. It's a big problem nationwide, no question. It was big even before I left Nashville. I remember several meetings with agencies that are working on that. And 5 years is a long time, so I can't even remember the young lady who was overseeing Metro. I think she left Metro now and writing for one of the local newspapers. So I remember several meetings with them. But it's what I would like to do when I get here, just to kind of understand where things are, and then develop a plan. I just noticed, of course, you can't, people always point to building shelters, and there's a place for shelters. We are building 3. But it's got to be broader than that. It's a sentinel, a symptom of the overall challenges we have in housing supply, helpful housing. And so there will be a robust plan that paints a picture of where things are, but also to develop a long-term plan now to fix that. I know just from memory now, I remember there's several efforts that have been going on in Nashville trying to address making affordable housing available and those things. It's a challenge across the country, but what I'd like to see, though, in Nashville is, and I'm not suggesting there are not existing plans, I know there are, But to take a look at those things along with public health and to take a look at those things from public health perspective and to look at what's available, what's not. Yeah, shelters we need, but shelters will not take us out of the problem with homelessness. It's got to be a more complete, and it's not just the government trying to do it. That the things to me is it's got to involve public-private partnerships. Of course, government has to be at the center of it. But what I'd like to see is paint a picture of where we are, very broadly, including not just temporal, but also spatial a representation of the issues and develop a plan that we can stick to for a long period of time. And the other thing that I notice in everything that we do is we do one thing for 1 or 2 years, and then we say it's not working, and we quit. Sometimes, from my experience, there's a lot of good things that we're doing. In many cases, they're not broad enough to be impactful, and in many cases, we don't do them long enough for them to be impactful. So if we all collectively, as a community, draw a plan and stick with the plan and join with our non-for-profits and private partnerships, do them broad enough. I'm a toxicologist. We say make sure the dose is high enough, but also stay on them consistently for a long period of time before we can make the impact. But I'd love to see where things are, see if we can modify the plan that exists, but more importantly, to develop an implementation plan to see where we can take things.
Great, thank you. And just lastly, an endorsement for the mobile spay neuter clinic for Councilman Bradford's point about MAC. Definitely would be a huge community ad and would fill a big need right now. But welcome, thank you, sir.
Thank you. I thought we were doing that before, right? We had mobile spay neuter. We had those. But anyway, used to? Oh, okay. All right. We'll look into that.
Thank you, Councilmember Huffman. In the queue, we now have Councilmember Webb, Councilmember Vo, and then we're going to go back to Councilmember Evans. I do want to make sure that everyone has the opportunity to ask any questions that you all have. I also want to acknowledge we started about 10 minutes late due to a few of us being caught in the traffic, but we're now 25 minutes late for our Budget and Finance meeting. So I just want to be cognizant of the time if we could be thoughtful in our questions. Councilmember Webb, you're recognized.
Thank you and welcome. My questions are sort of trifold or, they're all related together. What was your salary where you came from? And then how did you determine what you wanted in this position? And then the reason I want to ask the next question is, what metrics do you believe are essential for tracking public health? And how do we take that data to be able to measure the impact that you're having on your job performance and our public health out here? Was that too much?
And before we address the salary question, I believe the chair of the Board of Health, I believe Ms. Franklin, may be able to address that. Ms. Franklin, if you would you like to speak to that before I call you up? And if so, I can turn your mic on.
Sure, I'd be happy to address this. So I worked with Director Shannon Hall, who's also here in the audience, and I'm going to ask her to come on up. And we both approach this. We have experience. I have experience from my 9 to 5. Director Hall has done this with other directors, and so there was an examination of other similar positions from other directors of other similar sized cities. We also took into account a compensation analysis from within Metro Department. So it's a very thorough process, and we actually proposed a salary and started the negotiations there. But I'm going to turn it over to Director Hall for those details.
Thank you. Everything that Chair Franklin said is totally correct. We did a full analysis. This one's a little different. I will say from the standpoint of the public health space has changed significantly in the past 20 or 30 years. And much to the credit of the council and then the voters here, we changed the criteria that did not require for the first time in Nashville and Davidson County an MD for this position. So I will say, when we've looked at peers kind of all over the country, you've now got a real different set of criteria that really governs. Each public health department, not all of them oversee animal control center, right? That's something that's less common, but definitely very important to this particular position and its oversight. We've got lots of different varying degrees of not only size and scopes of public health departments, but what kind of degrees they require. We went through a really big, robust kind of conversation when this criteria, the charter was changed in 2022 to open this up. This was a recommendation from Human Resources to the Board of Health in 2018. They were undertaking all kinds of other efforts at that time, but were able to make a successful case for that before the council and then the voters in 2022. So we kind of, in my description, we took the best of all worlds. We looked at what criteria was used when setting this and tried to make it broad enough, but experienced enough so that we could get the right kind of candidate. And I think that really bore out in the finalists that we brought through. We tried to do like a break for like the cream of the crop. We brought 11 people to the panel interview for this director position, and that's extraordinary. We had a really broad cross-section, and then we brought 4 finalists to the board. I'm usually happy if we can get 2 or 3. And I think, as evidenced by the 11-hour day and the 2.5-hour discussion, I think the board really contemplated all 3. I think all 4 of them could have done the job. But when we looked at his salary, one of the things we wanted to right size was not only the breadth of experience that Dr. Ariola was bringing to this job, because the pay varies greatly among all those peers. We also wanted to do an internal right size setting so that we didn't create internal pay equities with other department directors. So we've set him at a pretty competitive pay versus many of his public sector market peers, but we think that this right sizes really the broad qualifications he brings, not only the experience internally that he's had here, including as interim director and deputy director for this public health department. He just didn't have the MD to get the job. I think he likely would have been a successful candidate in 2018 had that charter change already occurred. But I think it's helped to right size part of that. And then the requisite responsibilities for a medical director would stay with Dr. Shaw Kai, because that is still a function requirement that we need here under the state law. So quite a bit of analysis, and then really wonderful dialogue with Dr. Ariola, who was agreeable to, with a little bit of negotiation, agreeable to the terms that we presented to him.
Thank you so very much, Director Hall. And before I call on you, Dr. Ariola, Councilmember Webb, does that answer your compensation question? Okay, thank you. So what was the next part of the question so that he can address the next part?
What metrics do you believe are essential for tracking public health? And then how do you take that data to say, how is a program working for us to say that's working, those metrics are what we should be using?
Thank you, Councilmember.
Thank you, Councilmember, and thank you to the previous people. There's a part of the question I still want to go back and answer. You asked for my current compensation, precisely $244,007. In January, I'm entitled to 3% COLA and 3.5% merit. That takes me to precisely what you are paying me. So trust me, we negotiated. I've been doing this for a long time, yeah. And, people talk about MDs. Public health is not clinical care. It is different. And people don't get that. Every time that the skill set that you need to diagnose somebody and treat them, that's not what we do in public health. And if you continue to default to MDs whose only experience is diagnosing and treating, you're going to continue to have problems doing or running effective department. Now, in terms of metrics, a lot of the metrics that people have, that we currently do, we're going to continue to do them. They don't always work for me, as I'm being very clear about the health strategist role. Our metrics revolve around really programmatic things. And I'm not suggesting that some of the programs are not needful or necessary, but some of them we've been doing that for years, and we continue to do them because that's how we've done them. What we have to get to is to make sure that we are looking at those things and ensuring that they're still meeting the goals that we want them to meet. Now, the metrics that I want to do are at the strategist level, some of what I was talking about. What do we have in our communities? Are we building the right relationships with the right people? Are we nurturing them? Are we creating a culture of health where in those communities, those factors that are protective factors, sidewalks, again, the one thing is a lot of things that impact health are outside the purview of the health department. How we build our homes, how we run our schools, how we even build and run our prisons, all of those things impact health. It's very broad. The role of the health department is to work with those different entities to make sure that they're adequate. Again, you can go into a community where health is poor and nobody needs to tell you that their health is poor. You can see it. And so our job is to continue to work with those things and be bold enough to change our metrics to reflect those things. Our zoning laws, our code laws, our sidewalks, our capital investment, how are they creating conditions that allow everyone to be as healthy as possible? That's where we need to get.
Thank you so very much. And we're going to have Councilmember Vo to give our last question, and then the two chairs will give very brief remarks. Councilmember Vo, you're recognized.
Great, thank you so much, Chair. Hi, Dr. Ariola. Welcome back to
Good to see you.
Nashville.
Yes, yes.
Yeah, great to see you. A few months ago, the National Metro Council, we passed a resolution declaring that racism is a public health crisis. So I wanted to see what your thoughts were on that, and then if you are going to bring back the Bureau of Health Equity. Thank you so much.
Thank you. That's a question that I had a couple of times during the interview process. It is public health is about health equity. That's what we use data to do. And I know that politically it's taken on a life of its own. But the way we do public health is to use data to see where the challenges are. And where the challenges are, we try to study the factors that are contributing to them. We try to look at the trend over time. We try to understand them as much as possible so we can design interventions that would lift them up, not pushing anyone down, but lifting up to the threshold that we think everyone needs to be, where everyone, no matter what they look like, their sexual orientation has the optimal opportunity to be as healthy as they can. So to me, I don't know how you do public health without health equity. So I don't know that it's gone from the department. I'm not starting until a few weeks, so I've got to evaluate. 5 years is a long time. I've got to evaluate where things are. But we know that a lot of things, the fundamental things that contribute to health inequities, has to do with a lot of systemic issues. There's no question about it. I talked about poverty. It's not a stretch to know that if you're poor, your health is poor. It's also not a stretch to know that people of color, minorities, tend to be on the lower end of the socioeconomic status. Those are facts. And so, but we are not doing the politics of it. We are using that to understand the landscape so we can put in public health measures to bring people up and make them as healthy as they can. I look forward to working with you on those things.
Thank you so very much. We're going to wrap up the questions. I had about 5 questions, but you have answered all of those questions throughout the other responses that you have given. And I just want to thank the Board of Health for just doing such an amazing job through this process. I want to give a special thank you to the chair, Tanae Franklin, for all the work that she has put forth in this process. And I see why you have risen to the top as the #1 candidate. Dr. Ariola, I'm very impressed with the responses and the holistic approach that you're taking. One thing that I did want to lift up that I don't want a response to, that would love to hear more focus on as well, is the violence as a public health epidemic and how we can address that. But I'm very pleased with the way that you are taking a holistic approach and want to welcome you to Nashville and thank you for your service. And I will turn it over to Chair Evans.
Thank you, Chair. Just wanted to, I guess, put a pin in a couple things. And I always ask a lot of questions, and so you'll get to learn that about me, I guess. But one of the things that I think that your department has is really excellent epidemiologists. And so I think one of the things that I'd like to see kind of is a kind of revisiting like some of the data that's collected and how it is used. Like I was meeting with a nonprofit organization that works with Metro government, kind of speaking to Councilmember Huffman's question about homelessness. And they really need some support around data that will drive their construction of permanent supportive housing. And so some of those kind of interconnections, I think, across departments will be really important. And then also going back to your nonprofit organization comments and kind of their connection to the communities and how well they know, the communities that they're serving. I think we've kind of have had some challenges, in the nonprofit space with several that I have worked with that just feel like they're not being heard necessarily. So I think there's a ton of opportunity with your you coming back to Metro to really look at how are we hearing the concerns that they're bringing. Because I think we've kind of fallen into some of the issues that a lot of times government does, which is we want you to follow the policy. Maybe the policy does not work. How are we looking at the policy as a whole? And like Councilmember Allen is doing a lot of work around nonprofit organizations, but it's like once we get into departments, how everybody handles things differently. So there's probably opportunity for some improvement there. So anyway, I'm just going to put a little note, and at some point whenever I meet with you, then we'll talk about those things. But I appreciate your time, and for the Chair Franklin for accommodating all of my many questions and requests related to the resolution that we passed, and you participating in this meeting. It's the first time we've had a chance to do that with a director, and so we really appreciate your time.
Thank you. Thank you very much. Thanks all for having me.
Thank you, everyone. Thank you. And with that, we are going to end this meeting. Meeting adjourned. To order, we do have a quorum with 9 people present, 4 people absent.